You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
The testimonials appearing in this podcast reflect individual experiences and individual results may vary. Cardinal Health does not claim, nor should the listener assume, that any individual experience recounted in this podcast is representative of what another consumer may experience.
The Cardinal Health Counter Talk podcast, in collaboration with Pharmacy Podcast Network, is for independent pharmacists to learn about the state of the industry, innovative services and solutions, and the future of pharmacy. Join me, your host, Jason Callori, for conversations with pharmacists, Cardinal Health leaders, and industry experts, sharing best practices, discussing industry trends, and showcasing Cardinal Health products and services. You can subscribe to the Cardinal Health Counter Talk podcast on Spotify, Apple Podcasts, and wherever you listen to your favorite podcasts. Hello, everyone, and welcome back to the Cardinal Health Counter Talk podcast. I'm your host, Jason Callori, and today we're going to be talking about how modern payments can positively impact your businesses. Payments are not just a financial step, but a critical operational moment that directly affects production, fulfillment, staff workload, and patient experience. Today, we will be talking with Halston Prox, founder and CEO of Tabz, formerly HealNow, a New York-based unified commerce platform designed to streamline payments, refills, and operations for independent pharmacies. Halston focuses on healthcare technology and has experience in Epic system optimization and startup mentorship. Alongside, we'll be chatting with Natalie Girardi, Solution Manager of the Pharmacy Payment Solution. Natalie has been with Cardinal for 5 years and has supported a variety of solutions offered to our retail independent pharmacies. As the Solution Manager, she will be supporting pharmacies with enrollment, onboarding, and post-live support. She will be working closely alongside Tabz on the solution. Welcome to the show, Halston and Natalie.
Thanks, Jason.
Thank you, Jason. Hi.
Yeah, welcome in. So wanted to give you guys that little bit of introduction, but I do just want to start diving in here because I think this is a really interesting topic. And Halston, I'll start with you. What is Tabz and how is it beneficial to pharmacies and key decision makers, especially for independents?
Sure. Well, first off, Jason, thanks for having me. I'm glad that you're putting this together with Natalie. We are very excited about this partnership. And I'm looking to dive into the deep parts of payments as it relates to pharmacy. So what is Tabz? So Tabz is the unified commerce platform specifically focused on the pharmacy industry. And what that really means is that we are the end-to-end payment processor plus digital pharmacy solution for a ton of different type of pharmacies across the country. Specifically, Tabz really powers the integration with the pharmacy management system so that we receive all the information from the prescription and the patient, and powers the online checkout solution, as well as payments, as well as we integrate with delivery and shipping couriers, and we provide data back to the pharmacies who use our platform. So when we think about end-to-end, it's also the fintech plus pharmacy technology that makes all of this run. And so instead of having multi-vendors, multi-contracts, multi-support systems, you can utilize one company that's really focused on the pharmacy industry that will not only make sure that you're doing PCI compliant payments, but also you have a checkout experience that really dials down to conversions. And so our process is an omni-channel process that we have for payments online, in person, even over the phone. So that's what Tabz is.
Natalie, from your perspective, how have you seen Tabz integrated, with Cardinal Health independent pharmacy customers?
Yeah, absolutely. So the big thing with Tabz that drew us to them is they are pharmacy focused, which is big for us because in the pharmacy space, have so much to manage just outside the payment processing world. And the payment processing side is very complex. So our goal is to really make their lives easier. How can we support them with in-store payments, online payments, make those deliveries easier, really save them time within their pharmacy and just take some of that workload off of them. And Tabz has been great for that, of really understanding who our pharmacies are, what they go through day to day during the demos, really asking those questions of how their workflow is today, what they really need out of it, what they're not getting today, and how our solution can really benefit them. Just they have so much going on, and we want to make it easy and have that hands-on support. Because again, with the complexities, just the integrations, the setup, the different system features, and how to use it in store versus online, there's a lot to tackle there. And our goal is to make that setup easy and then really make a difference on their day-to-day workflow.
Yeah, I love that. Halston, you had mentioned, multiple pharmacy payments, and Natalie, you alluded to this too, is, kind of being in one place specifically. In general, just kind of high level overview, what payment issues and operational problems occur inside a pharmacy that could hinder a service like this? What are those common challenges that pharmacies face today regarding their operations and payments in general?
Sure. Yeah, Natalie said it best. We've got a lot going on, but it's all in support of our pharmacies, right? And so as we specifically talk about, Jason, some of the pain points, you think about two different aspects. The first part of this is about the actual payment rails, right? So for example, a patient is wanting to use their HSA and FSA card for a prescription. How are your auth rates as it relates to HSA and FSA payments? Are those cards being actually declined because the processor doesn't know how to send or doesn't have the information to send the right information back to card brands? Or is it related to the clinical aspect of an online checkout solution? Most of our customers that we work with as it relates to online and in-person and omni-channel experience, you're going to have to build out a ton of things. You're going to have to find a payment processor. You're going to have engineers to build out a checkout, HIPAA compliant checkout experience. Then you got to have those same engineers build integrations with courier services and delivery services. So these are like huge challenges as it relates to what independent pharmacies have to go through just to take online payments. And unfortunately, this isn't an industry that you can simply use a horizontal payment processor to take. Like you're not selling ice cream. You're not selling coffee. These are highly regulated items that you're selling, which means that you need to be compliant every step of the way. And that's what we help with.
And that's really hard of what we've seen with pharmacies is those complexities really add up of like, I don't know what I need to do. This is expensive. This doesn't make sense to me. And so having someone that understands that side at the beginning, it's like, nope, we have this covered. You don't have to worry about it. We know exactly what needs to be done and when, and not trying to add on all those extra fees with it.
No, that makes sense. And I guess kind of my next question would be, so obviously Tabz is integrating all these different types of payments that have to be utilized, but are you guys customizing this solution for each pharmacy, or do you guys have this figured out to a point where, as long as they're using the solution, you could cover all these different types of payments?
Yeah, great question. So we serve a ton of different pharmacy types on our platform.
Yeah.
Retail is very different from specialty, which is very different from compounding, which is also very different from LTC. And the customers that we serve typically are in one of those buckets or in all of those. And so our goal is to make the experience as easy as it is to sign up for Shopify, to really cater and get really down and embedded in the workflow so that certain prescriptions that are retail will only be processed in a certain way or and go into certain buckets and business rules versus compounding, which needs payment before it's even filled, right? And so because of these requirements, we had to build the platform very flexible to cater to pharmacies who are doing multiple or hybrid models.
No, yeah, it makes total sense. That's, that was kind of lead into my next question, which was, to Natalie, I'll kind of pitch this one at you. What should pharmacy owners be prioritizing when processing their payments? What should they be looking for in a payment solution? And I guess this obviously will relate back to what Tabz offers. But what just from the beginning, you have a pharmacy that's struggling with these different types of payments, and they want to integrate a payment solution into their everyday. What should they be looking for?
Absolutely. And that's a great question. This is really at RBC when we try to have those open-ended conversations on the show floor, why demos are so important to have at the beginning to really learn who the pharmacy is. Like Halston said, we want to know what that pharmacy type is. Are they a retail independent? Do they have any compounding specialty? Just to make sure we know who we're working with. And PMS integration is going to go a long way because there's bidirectional integrations. There's ones that are not integrated, but we can still make this solution work for them. But we have to have that open-ended conversation at the beginning of, okay, we can make this work, but here's what might be different. We want to know if they offer delivery. We want to know if they have an online presence. Just everything's turning digital. So the more patients they can meet and give more options to their patients, like we really want to know to them what's important to them. But that PMS integration is going to go a long way. And so why we partnered with Tabz is because they are pharmacy focused. We understand the other guys don't know what pharmacies mean. They are adding on all these extra fees for them with processing rates and different types of fees during transactions or just to get a statement and maintenance fees. And we wanted to take that headache off of them and say, hey, we have found a trusted partner who is pharmacy focused. We took that burden off of you. And then with this solution, we offer a lot of different features for you to see what you need. Do you need the texting? Do you need QR codes at your drive-through? Do you want OTC upsell during checkout? So when they're getting their prescription, they could add on some extra items, and having that hands-on support of where we're doing the demo calls and we have onboarding calls to make sure we're doing this very efficiently for them to not spend too much time on the getting started process. So that way they can be up and running hopefully within 3 weeks and just get everything cleaned up for them. So we have taken some of that prioritization of we found the trusted partner and we have a good workflow for them.
Yeah, that's really important. And also, I'll ask you because I know, just talking to so many pharmacists over the last couple of years doing the podcast, there's always a little bit of a trepidation to get into something new.
Sure.
Creating something new in the workflow, trying something new could be a little bit scary especially for an independent business owner who's just trying to, do their due diligence and make sure that it's the right fit. That's going to not really disrupt their everyday. So Halston, for you, how does each pharmacy evaluate, initiate the change, and what do you guys do to implement without disrupting their existing workflows?
It's a great question. And I also want to say to Natalie and the Cardinal Health team, they brought us a ton of different things that they were trying to solve. And what you're saying, Jason, is part of the approach. They asked us if we could solve these problems that the pharmacy industry is facing, right? And what really makes us excited about this partnership is that there are a ton of different things happening in this industry all at once, right? You've got pharma movements, you've got new drugs, you've got new ways of access for patients, which is a huge deal. And Cardinal Health is at the forefront of doing all these things and working with their network of pharmacies, right? Mm-hmm. So I would say that one of the things that we push pharmacy owners to understand, no matter if they have one location or they have 500 locations, is the fact that this industry is changing very quickly. So no longer are you required to have only one way of paying for a prescription, whether that's an HSA or that's a Visa card, right? Why can't you use 2 cards for one transaction? Why can't you use buy now, pay later options, which are in all the other industries? So how we position this is about conversions. It's like real revenue quicker, and automation. How do you automate all of your prescriptions from intake to delivery, right? So these are some of the things that we are often educating pharmacy owners, multi-store owners, and obviously like enterprise customers that they need to be thinking about what's coming in the next 2 years from now, right? Access online capabilities, meet the patient where they are, allow them to pay the way they want, and provide a transparent view of where the prescription is throughout the journey.
Yeah, that's very. I like how thorough that sounds. I mean, I'm obviously not on that side of it, but I think that, again, just like I said before, in talking to pharmacists, it is a challenge sometimes. But I think it just sounds like the amount of, I guess, the amount of options you guys have created really makes it a bit different than what I've heard of pharmacy payments in the past, which takes me to my next question, Natalie, because as you mentioned, this launched at RBC last year, 2025. And as you were having those open conversations with pharmacists and independent pharmacy owners, what were those initials? What were the initial conversations like, and what should new customers be aware of now that we've, we're not exactly a full year into this, or maybe you are, but what have you seen in the past year or so that you could tell a pharmacist how it's been impacting their business?
Yeah, absolutely. I mean, we are coming up on a year with this solution officially being live, which is very exciting. Definitely want to keep that momentum going of, having Tabz around. They are paying attention to what's changing in the payment scape. So that way our team doesn't have to track that, pharmacies don't have to track that. And we want to know what new PMS integrations we can bring to them, what new features we can bring to them, of having those open-ended conversations of how things are going, what needs to be adjusted on their end, especially, all conversations are always around staffing shortages and different regulations they have to be on top of. So at the beginning of the year and the end of the year can get really taxing for them if they have so much going on. So we want this to be able to just be running smoothly through anything their pharmacy could possibly be going through, and have a holistic solution of how much can we fit under one umbrella for them, so they're not having to have 5 different logins and, where do I pull this report? How do I do this? And what payments can I take? And just make this easier as this world keeps changing, and just making sure, we are staying very connected with them and really capturing that feedback. And, we've had some good conversations with customers that are enjoying this solution and have been able to save time, and, staffing shortages aren't as much of an issue. And so we really want to continue to grow that conversation with our pharmacies and just continue to grow this solution with them.
Yeah, in Halston, this kind of goes back to what you were saying earlier, but I really want you to kind of dig deep into, what really sets Tabz apart from a lot of these other pharmacy payment models that are out there. What's your differentiator?
Yeah, it's a great question. So I believe that with Tabz, you are going to get the industry knowledge, and as well as the backing of a tech company who understands healthcare/pharmacy payments first, not as an add-on, right? And so whether you are thinking about doing online payments and in-person and drive-through and curbside pickup, there are a lot of challenges that exist, especially from like a compliance standpoint, and payment standpoint, and PCI and PHI standpoint. A lot of acronyms there.
Yeah,
a lot of stuff going on. So because of that, we want to make it very simple to have one place where you can sit down and talk to someone who actually knows your business. They know what you're going through, and they can provide you solutions based on the different business needs that you have. That's the difference between a vertical SaaS payments company versus a horizontal company who really just focus on payments, and they don't care what industry you come from. Whether I don't know if you have like 5,000 car washes, but they can take you. We only focus on the pharmacy industry.
No, yeah, no, I absolutely love that. How often are you guys, I guess, surveying the terrain out there as far as the independent pharmacy landscape, and having to change and almost reintegrate new payment processes, or because if I'm a pharmacist and something immediately changes, whether it be from Medicare or from another payment standpoint, how quickly are you guys able to react to that to change it up for the specific pharmacy payment plan that's in place?
Yeah, I think that because of our customizations and flexibility, our customer success team works with all of our customers to provide unique and a unique value add, I'll say, right? Which means that on a drop of a dime, if something is changing in the industry with Medicare and Medicaid, and it's affecting a pharmacy in different ways, we have different rules and different uh, features and functionalities within our platform that we are able to customize and change where prescriptions go, how much do they show for a patient, and what we can offer to patients to subsidize their costs. So that's kind of how we look at it.
No, yeah, I love that. Natalie, do you have any, being almost a year in, do you have any insights or examples of some success stories with this solution, or examples of pharmacies reducing an unpaid compounded prescription, something along those lines?
Yeah, absolutely. So actually, I spoke with Jessica Beal just from Hobbs Pharmacy recently. They are located in Florida. We spoke with them at RBC. So they enrolled at RBC last year, and they were actually our first customer to go live. And they do have an integrated PMS, but I would love to share a quote that I got from her because she had great things to say about this solution as a compounding pharmacy of just how much this has done for her already. And she saw the value of, like, especially a startup pharmacy, like if you got in on the get-go with this solution, how it could really transform how you even set up your pharmacy at the beginning. But her quote was, "As an independent pharmacy, efficiency and patient experience matter deeply to us. Integrating Tabz into our workflow has improved how Hobbs Pharmacy manages payments and patient experience. By allowing patients to prepay for their compounded medications, giving patients the power rather than relying on saved cards or time-consuming follow-ups, we've streamlined our operations and eliminated unnecessary delays awaiting on patient follow-up. The platform also gave us a simple way to recommend OTC supplements and supplies online, which has helped support our front-end sales. Most importantly, it's helped simplify our pickup and delivery process, creating a faster and more efficient experience without adding additional staff. Tabz has truly helped us run a more modern, patient-centered pharmacy," which I think is an amazing quote to get from them.
Wow, Halston, I know it's a little bit of a long quote, but you should figure out a way to get that on a t-shirt, something.
Absolutely. Absolutely. I love it. And thank you so much for the quote. That was great.
Halston, what success stories do you may have that's been out there that you've come across?
Oh, Jason, you put me on the spot.
So yes, I like to do that. Sorry.
No problem. I think there's so many, Jason. There's different buckets, and this is kind of what we've seen across the portfolio of our customer base. We've seen customers who have increased OTC sales. We've seen customers who have been backlogged with 600 prescriptions and didn't know how they were going to get through the payments and getting patients on the phone to call them one by one. And they were able to quickly get through that in a matter of a day or two, right? Just by turning us on. So it's a plethora of things: increased revenue, decreased labor and time spent on the phone, so that you can focus on what really matters most, which is patient care. And providing the services that you currently offer to your patients.
This has been incredible, guys. This really gives me a lot of insight. I know I did a lot of research before, just coming on to talk to you guys. I really wanted to learn more about this, and just hearing how much it, honestly, just from the outside looking in, from my standpoint, someone who's not an independent pharmacist but has talked to a lot of them, I can really kind of feel how much this could really benefit an independent pharmacist, especially, one to Halston that you just talked about, one that's really struggling with the amount of payments backing up, backlogging. I think the pharmacy shortage and people overworked is a big thing. I think that could be a huge benefit to implementing a service like this as well. So, Natalie, I'm just kind of to throw it back to you. tell the audience where they could find more information about Tabz, especially if if they're with Cardinal Health.
Yeah, absolutely. Thank you so much, Jason. Yeah, this has been amazing. And I'm truly hoping anyone listening took a lot away from this and has a lot of questions and wants to talk to us and get to know this solution more. But on the cardinalhealth.com page, if you search for pharmacy payments, we do have a page there, and you can complete an interest form, just some basic information that gets provided to the pharmacy payments team within Cardinal Health. And then we will work with you to set up a demo with the Tabz team. So that way you can really get 30 minutes or however much time you need to really go over the solution, ask questions, really talk through your workflow so we can make sure that this solution is a perfect fit and make you feel comfortable about your needs, and discuss the level of PMS integration, and then just get you up and rolling, hopefully.
I love that. All right, guys. Well, I want to say thanks to both Halston and Natalie again for giving our listeners some great insights and a clear understanding of how pharmacy payments powered by Tabz help Cardinal Health customers reduce friction, improve cash flow, create more predictable workflows without adding maybe some unwanted complexity. Now, if any of you are interested in adding Tabz to your workflow, again, you can visit the cardinalhealth.com page to learn more and even schedule a demo with Tabz. Thanks for listening to today's episode of the Cardinal Health Counter Talk podcast. And as a reminder, this is your first time listening, make sure you subscribe and download the Cardinal Health Counter Talk podcast wherever you get your podcast. See you on the next episode, and take care, everyone.